In 1984, the National Institutes of Health Consensus Conference on Osteoporosis sparked national media interest about this disease. Immediately following the conference, we developed a strategy to respond to the broad public who wanted to know more about the topic. The National Osteoporosis Foundation was born as a result, and is now the nation's leading voluntary health organization, solely dedicated to osteoporosis and bone health. Since its founding, NOF, as we call it, has pioneered the effort to make bone health a reality and lifelong priority for all ages. Our mission is to change the course of this devastating disease by preventing it and related fractures, and by promoting lifelong bone health. We're committed to improving the lives of those affected by osteoporosis through programs of awareness, public and health professional education, advocacy, and research. Today's NOF is dedicated to those who have firsthand experience with osteoporosis. I'm talking about the patients, families, caregivers, physicians, and even the healthy public. We're here for all who want to break the cycle of this disease and ensure that future generations never experience the loss of mobility, independence, and even life that comes with broken bones. NOF is first of all committed to providing assistance to those who have already broken a bone. Even more so, we're devoted to preventing secondary fractures through better diagnosis and treatment of the first one. NOF promotes Strong Bones for Life by offering the most up-to-date educational materials for patients, physicians, and advocates alike to use and share. Our partnerships make us successful. As the leading osteoporosis resource for patients and healthcare professionals, NOF organized a public-private partnership. The partnership consists of for-profit and nonprofit organizations who want to tackle key issues within the healthcare system and change the paradigm of care for fracture patients. As a convening partner of this group, NOF is working to advance a new post-fracture hospital protocol. Our process will ensure that everyone who breaks a bone from osteoporosis receives appropriate diagnostic testing, medical treatment, dietary and exercise advice, as well as a personal fracture liaison nurse at the point of fracture treatment. This major multi-million-dollar initiative will change the way care is coordinated for fracture patients, and it will allow for better treatment of patients at a lower cost to the Medicare and Medicaid systems. Critical to the success of this new fracture service is the one-on-one interaction with the liaison nurse. We're using a model that's been proven successful in assisting and guiding those who've previously fractured and made a full recovery. This program will establish a new standard of care for the 2 million patients that suffer from broken bones each year, and it will protect them from future breaks. Our goal is for them to get back on track, living a long, independent, and healthy life. Like many nonprofit organizations that have weathered the recent economic shifts, NOF has transitioned to become an even more lean and effective organization. Our staff is efficient in prioritizing the initiatives that'll deliver the most impact for both patients and healthcare professionals. Making good on our promises is what guides our decisions about the projects we seek to fund and implement. In addition to everything else we're doing, NOF has set a 2-year goal to raise $2 million through individual contributions and elevate osteoporosis to a health issue of national concern. We're working to reach and educate mothers and daughters by encouraging them to start conversations about bone health and family history. We're challenging them to spread those messages to their friends, other family members, and healthcare professionals. We'll know our efforts have been successful when women are asking their doctors for a bone density test as routinely as they're asking for a mammogram. NOF wants all women over 65 and everyone else who breaks a bone to be tested for osteoporosis. Doing so will help prevent secondary fractures and move the population as a whole toward living long, independent, and healthy lives. One by one, we can change the lives of the 2 million Americans who fracture every year, and we can make a significant difference for the 44 million Americans currently affected by osteoporosis. Historically, osteoporosis has been an underdiagnosed, undertreated, and underestimated disease. It's often considered a silent disease or something that only affects little old ladies. The condition itself lacks the urgency or relevancy that often attracts public support in demanding a solution. To break through these perceptions, we've recently shifted our message away from being a pretty and polite one to using a much stronger tone. With 2 million bones breaking every year in the U.S. due to osteoporosis, we want the public to feel the impact of how this changes and ruins lives. So we're pushing them to do something about it. Osteoporosis isn't a little old lady condition. In fact, anyone over age 50 who fractures can have osteoporosis, regardless of how fit, active, or youthful they are. Sadly, of the 2 million breaks that occur each year, less than 2 in 10 patients get follow-up care or testing for osteoporosis. That's unacceptable. People need to connect broken bones to osteoporosis and ask their doctors for a bone mineral density test. To accomplish this, we're issuing a direct, specific, and clear call to action. We're shifting public perception of osteoporosis from a natural consequence of aging to a preventable and treatable disease that no one has to suffer from in silence. Since our founding, researchers have developed effective new treatments for osteoporosis. We're proud of our accomplishments in this area. People of all ages are learning that exercising and eating right can promote a bone-healthy lifestyle that helps prevent this disease. Bone mineral density tests can tell you if you have osteoporosis before you break a bone, making early detection and prevention more of a reality now than ever before. As a result of these advances, osteoporosis has never been more treatable and beatable than it is today. But with 44 million Americans still affected by it, we know we have a lot of work left to do. NOF is faced with the challenge to modernize. We must update our old systems and outdated ways of operating, all while learning to adapt and thrive during lean times. We've been fighting to maintain our role as the premier osteoporosis resource with the most current, up-to-date information and education for patients, physicians, and the public. And we've been doing this while receiving less in donations from major individual donors as well as from large corporations. With additional resources, NOF will expand our national network of support groups. We currently have 56 active groups in 26 states across the country, including the District of Columbia. With additional funding, we'll add a much-needed 80 more support groups over the next 2 years to establish a truly national presence that'll support our patients and their caregivers. Support groups provide an open forum where patients and caregivers can share information and resources with another. With additional funding, NOF would expand our phone and online support. We'd like to form a national hotline to better meet the needs of patients in areas without a dedicated support group. This would also give additional access to those who can't attend support group meetings on a regular basis. In the meantime, we're pursuing grassroots efforts by identifying leaders who will form support groups in strategic areas of the country. We'd also like to enhance the level of education we offer to medical personnel in order to ensure the best possible care and support for those living with osteoporosis and low bone mass. NOF is enhancing our nurse and nurse practitioner education materials. We're also convening an exercise and rehabilitation council to develop clear guidance for professionals and the public on exercises for bone health. This outreach, coupled with the efforts we'll step up within hospital systems as the funds are secured, will allow us to develop a standard of care for osteoporosis, and it'll better equip primary care physicians with the information they need to more adequately treat and counsel osteoporosis and fracture patients. With additional funding, NOF would work to close the awareness gap. We'd engage in year-long aggressive media relations and community outreach to build a national network of mothers, daughters, and partners. We'll start conversations about bone health and the importance of family history. This ongoing effort would spark and sustain a national dialogue on the seriousness and consequences of this disease. It's our mission to put osteoporosis on the radar of the next generation and to get them to take steps now to protect themselves against this debilitating disease in the future.